All right, great. We are recording. So this way, anybody that's not able to make it tonight, or if anybody here wants to review any of the information covered in this session, we can do so later. Additionally, as well, you have the ability to rename yourselves if you have the option to do so. If you're comfortable with Zoom and know what to do, could you rename yourself for your first name and last name, and then identify your P1, P2, P3, P4, so that way our speakers tonight know exactly who the questions are coming from, or they're able to identify your specific needs based on where you are in the program. I'd appreciate that greatly. The next few things, as well as we're going to be talking about everything residencies. So in a second, I'm going to turn it over to Dr. Nicole Campbell, and she's going to go over with the panel some information, and they're going to share their experiences. So again, I appreciate you all being here tonight. And if you haven't done so already with your Zooms, again, renaming yourself is super helpful, but also signing in with your single sign-on does help for attendance credit. So at this time, if anybody has any questions, they can directly message me in the chat, but I'm going to turn it over to Dr. Nicole Campbell.
All right, thank you, Justin. Good evening, everyone. I'm happy you guys are all able to make it. We kind of threw this together last minute, so I'm really glad you could be here. So as Justin said, make sure as you're coming in and getting yourself situated, if you can try to rename yourselves with your first name, last name, and then your year in pharmacy school, so P1, P2, etc. So tonight we are lucky enough to have a few different pharmacy residents, as well as a pharmacy residency coordinator with us to hopefully share some really important information with you guys about how to go into like these career fairs and mid-year and interview season with confidence, and for everybody who is looking to potentially pursue a residency, maybe some of the things that you can do to really help you secure that residency position. So I do have some guiding questions here, but feel free if you have any questions that you would like to ask the group throughout. You can either raise your hand or enter it in the chat box, and I will make sure you get a chance to have your question asked. So we'll go ahead and get started with some introductions. I will just kind of go over, since I'm sure I haven't seen many of you. I am Dr. Nicole Campbell. I am FDU faculty. I am one of the Advanced Pharmacy Practice Experience preceptors. I'm a clinical pharmacist in internal medicine at Morristown Medical Center. So I take APPE students on their acute care rotation at Morristown throughout the year. And then we'll go through kind of everyone else that we have here. So Kunal, why don't you start?
Sure, thanks, Nicole. Hi, good evening, everyone. My name is Kunal Shah, and I am a assistant manager of clinical pharmacy services at Morristown Medical Center. So just a brief background on myself. I completed my PGY1 residency with Atlantic Health System several years ago. And after that, I precepted the internal medicine and ambulatory care rotations for our residents for about 2.5, 3 years. And now for the past 5.5 years, I am overseeing our clinical pharmacy program. So I have about 20 clinical pharmacists that report directly to me. And I am the site coordinator for our residency program at Atlantic Health. So our program is a 2-site program that includes rotations at Morristown and Overlook Medical Center. So being based at Morristown, I'm the site coordinator at Morristown.
Thanks, Kunal. Dorcas.
Hello, good evening, everyone. My name is Dorcas Agiloco. I am a PG1 pharmacy resident at Montefiore St. Luke's Hospital here in Newburgh, New York. I had a little bit of a non-traditional path to residency. I actually worked in the retail sector for about 1.5 years before I transitioned into the residency program here. I'm glad to be here today, and I'm excited to share the little bit of wealth that I have so far.
You and me both, Dorcas. I worked at CVS for 1 year before going back and doing residency. So if anyone needs some insight on that, we've got some good people. Kylie.
Hi everyone, my name is Kylie. I'm a PGY1 pharmacy resident at Atlantic Health, so split between Morristown and Overlook Medical Centers. I got my PharmD at Rutgers this past May, and I'm staying on to do a PGY2 next year, if you guys have any questions about that as well.
Shivam?
Hi, everyone. So my name is Shivam. I graduated from Rutgers as well last year. I did my PGY1 as well at Atlantic Health. So there's a lot of Atlantic Health in this Zoom right now. And then I'm doing my PGY2 in ambulatory care within the Robert Wood Johnson Barnabas Health System.
And Johnavy.
Hi everyone, I'm Johnavy. I'm a PGY1 resident also at Atlantic Health. Yeah.
All right, thank you guys. So yeah, I think we've got a good range of people here for you guys to hear from. So I think, what I want to start with, since you guys have your career fair coming up on Friday. So in residents, you guys can chime in any order, but what are your tips for kind of optimizing their time at a career fair or mid-year, or kind of like any tips you have for kind of navigating those really big events?
My big tip for mid-year in particular is definitely planning ahead. Before mid-year, they release a diagram of the different booths that will be present, the different timing that different programs will be presenting. So definitely making a list of like all the programs that you're interested in and knowing what times and the locations. It makes it more efficient, and you're able to make sure that you get to those locations first. And then afterwards, of course, you can always, roam and casually see other programs, but definitely utilizing the information that they're going to release ahead of time, and then using that to your advantage and making sure that you get to those spots.
Yeah, just to add on to that.
Yeah, I'll just add to.
Sorry,
Kunal.
Yeah, just to kind of add on to that, like it's really important to be prepared. So coming with like questions, like doing your research on the programs beforehand, and then also knowing, like Dorcas said, like which programs you want to check out. And it's important to kind of know what your priorities are going into it. So do you really care about the rotations? Like, are you really interested in critical care and you're looking for a program that has a good critical care rotation? Yeah, so just knowing like what questions that you want to ask, and like making sure to ask like good questions and not stuff that can be found like on their website.
Yeah, and just to add to that, the showcase sessions go pretty quick, even though they're a couple hours long. And you may have 10 or 12 programs that you want to talk to in just one single session. So efficiency is really, really important. So just like everybody said, knowing which programs you want to go to, knowing where they are in the hall, so you don't have to walk back and forth across the convention hall, because it is a large space. And like John V said, pick out those important questions that you want to ask. You're only going to have a couple of minutes probably at each booth if you need to move on to others. So picking out those key questions that you can't find answers to on the website is going to be very important.
Yeah, kind of picking back on Johnavy and Kunal's responses. So when you ask questions, don't ask something that you can actually like find online. Be like pretty specific about it. You can always ask like the current residents or their students or something at that site, more specific questions. And then also if it gets really busy, whether it's through like a virtual platform or in-person mid-year, always circle back to that location, just because again, time is really important. So
yeah, I would mirror everything everybody has said so far. Also, just knowing what types of questions you want to ask the different types of people you're going to meet. So you're going to meet current residents, you're going to meet admin, you're going to meet preceptors. So just having questions set out for those different types of people so that you're prepared with whoever's at the showcase or at the booth, and the types of questions to ask those specific people.
And if I can add just one other thing too that I just thought about, if you have a good connection with someone, so you meet someone at mid-year, there's a great conversation, you make a great connection, I think it'll be really prudent to get their contact information, and maybe you can follow up with an email or something afterward just to kind of like solidify that connection that you had.
Yeah, those are all really great tips. I know any of those events can be super overwhelming, especially if it's your first time going. So you all mentioned, making sure you prioritize what kind of, what places you want to talk to and kind of mapping out. I remember having my printed map and like a highlighter and like all my, paths marked out for who I wanted to talk to. But what kind of tips do you guys have for even figuring out which programs are the ones that you want? I know Genevieve touched on, if you're interested in critical care, but what are maybe some other things that you considered when trying to choose which programs you wanted to talk to and apply to?
Something that stuck out to me was I wanted to be at a program where there was multiple residents. Like I wanted that support system and I wanted to go through the process with not just myself. So I liked that my program had 4 of us residents. And I also liked that there were really diverse rotations. So I knew what I was interested in, but I also wanted exposure to a lot of different things. So that was something that I made sure to look for in all the programs I applied to.
Yeah, probably another thing is honestly just because like we're straight out of school, so it may not be financially feasible for a lot of us. So location is another thing to consider. So personally, I wanted to stay home, so I kind of applied to programs within North to Central Jersey, and then as well as what Kylie said. So I had a general idea of what I was interested in, but I did want to explore other rotations as well. So choosing a program that had a robust amount of options. So that's what I considered.
Yeah, just echoing off what Kylie and Shivam have already said, something else that mattered to me was like the preceptors. So I would ask a lot of the preceptors like what their teaching style is and see if that kind of fit what my how I learned the best. And then just seeing how they give feedback, just seeing how well the preceptors would work with the way I learn, and how well we would get along. That was something that really was important to me too.
All right. Yeah, I think those are all pretty good factors. I know definitely like location and looking for the things that you're interested in, especially I think to kind of go back to what Genevieve was saying about having like strong rotations in a particular area. Like if you want to pursue a PGY2 in a particular area, like maybe also make sure that your list is full of places that actually offer a PGY2 in that area at that site, as a potential to either stay on, or just kind of that's like a factor in knowing well, they have a PGY2 in that, so their rotations are also probably really strong in that particular practice area. So yeah, those are all really important things to consider. So let's see. How about when it comes to, you've done all your searching and you've talked to some programs and now we're getting into the application portion. So are there anything, so kind of 2-part. So for Kunal, and I can always chime in too, what are some characteristics that stand out? What do you look for in a cover letter? And then for the residents, if you guys have any tips on how you kind of approached the application process.
Yeah, that's a great question. And, no two programs are going to be alike in what they look for in a candidate. And that's something that you kind of have to keep in mind as you go through talking to these programs and understanding what they're about. Every program is going to have different values, and that is going to potentially be a good fit for you, or it may not be a good fit for you. And it's hard to kind of understand some of those things, but you might be able to get a sense when you're talking to folks at mid-year or at, career fairs and things like that, in terms of what that environment is like and what those programs value. In terms of kind of what I look for in particular in a candidate is really somebody that's well-rounded. So somebody that has a good balance of a strong clinical foundation, whether it's a lot of clinical rotations or, good grades in some of the therapeutics classes, in combination with, experience in areas such as research, in, careers such as working as a technician, whether it's in a retail setting or a hospital setting. So we kind of look at a little bit of everything and look for a really well-rounded candidate. I always tell our residents and our preceptors, we're really looking for somebody that has, a strong foundation that we can build on. And that's really what our goal is for our residency program, is to help build on the foundation that you've developed in school. So, sometimes some of those things are not tangible and others are, and that's what kind of makes it challenging in both preparing for an interview as well as kind of screening candidates.
For the application part, at least, I think around this time would be like a good idea to, or maybe even before this by now, like reaching out for letters of recommendation. So, while you're a student, for some of you, when you go on rotations, whether IPPEs or APPEs, having that connection with any of your preceptors that you have that you can really go back to and ask them to write you a strong letter of rec. I think that's like part of the beginning of the process, as well as like fixing up your CV, and then making sure you send out that CV to mostly preceptors, I would say, or like upperclassmen, if you know some who can help you with your CV. And then from there is really writing those letters of rec and letters of intent, and for those as well, you should get as much feedback as possible. So I think getting feedback is probably the biggest thing, and you can never get enough feedback. But that's generally how it goes. It's usually like your letters of rec and your CV first, and then letter of intent, as well as filling out like forecast, which is the application portal for residency. So those are just some things that kind of go into the application process. I'm sure some other residents have more insight about them.
Shivam made some really excellent points. A lot of the things I was thinking he did mention. Also wanted to add that in terms of the application, just to be aware that some programs will have like supplementaries. So it's good to make sure that you're checking for those. So your letter of intent and your CV, of course, but make sure that you don't miss something as like a supplementary that some programs do ask in addition.
Yeah, also something that I did on top of the stuff that's listed in your CV, I tried to keep a running list of interventions or like stories from rotations that I could kind of like focus on for my letters of intent, or for even like interviews or interview questions when the time came, just to keep a running list of things to talk about that you've done or you've been involved in that stand out, and try to, focus on, because everybody has so many things.
Yeah, there's some programs that have different requirements, like more specific requirements. So most will require 3 letters of rec, some will require 4. Some will ask like the letter of recommendation writer to talk about specific characteristics. When you look at the portal, you'll see that it's not an actual formal letter. It's like they talk about different aspects, like different characteristics and stuff. And then just some tips for the letter of intent. Make sure to include like why specifically you're interested in that program, like what about that program specifically attracts you, and then like why do you want to do a residency, like what your future goals are. So those are like the most common things that you should include in all of your letters of intent.
Right. You're gonna get a thing. Right. Right. And write a reflection every Friday.
The letter of intent is probably one of the most challenging pieces of the application, at least from a reviewer standpoint. I feel that way as well. And I see John B nodding her head. Letters of intent are very tricky because, as John B said, you do want to discuss why you like that program, what interests you about residencies and things like that. And oftentimes people try to make them unique. And honestly, some of the more unique letters that we've read truly do resonate. Sometimes people will tell us a personal story about their life and what kind of got them into healthcare and things like that. So if you feel comfortable, talking about some of those things, definitely feel free to. It gets challenging when the letters get too long. So keep that in mind. Try to keep it concise, because after a while, it kind of becomes challenging for the reader to be continuously engaged in the letter and what it's saying. And I know this goes without saying, but I will say it anyway. Before you submit your application, please, please, please make sure you've included all of the relevant packet pieces for that specific program, and not accidentally pulled in a different letter of intent or added something that doesn't belong there, added it like somebody said, a fourth letter of recommendation if you only need 3. So just try to kind of proofread that and make sure you're not waiting until the last day till that deadline. I know folks have had trouble with forecasts, especially as we get into the first week of January when a lot of the programs have their application deadline. So take that extra time, proofread your entire application, and make sure you're including exactly what you need for that program.
Yeah, that reminded me also, not every program has the same deadline. So always make sure that you look for like which one is the soonest one, and you make sure that you don't miss it under the impression that they're all the same. A lot of them are around the same time, but some of them come up sooner than you think. So double check the deadlines and put them on your calendar.
Yeah, I think most of them tend to be January 1st or after, but you will get the occasional one that's like December 30th or December 31st, as crazy as that might seem, but it is possible. So it is really important to be on top of that. And like Kunal said, with submitting all your packet stuff, even the minor details count. So please make sure it's addressed to the correct person. So like at Atlantic Health System, we don't want to see a letter directed to, the residency program director from Montefiore, because that means you're not paying attention to, who you're submitting this to. And I know for cover letters, as we said, like they're probably one of the most difficult things to write, and to try to make them as kind of specific and personal as possible. And it's okay to kind of have like a general form of what you want to say and then personalize things throughout, but also make sure that you're making it relevant to the program that you're applying to. So, maybe there is a program that offers, a strong pediatrics rotation and you're really interested in pediatrics. Definitely put that in there, but a program that doesn't have pediatrics is not going to want to read about how much you love pediatrics, because they can't offer that to you. So they're going to wonder why they're a good fit for you and why you're a good fit for them if your kind of learning goals and teaching goals don't align with one another. So we did get a question from one of our students that said, pretty much for our current residents. So there's obviously a lot that goes into this kind of time frame of the year. So how did you guys manage to stay organized while applying for, several of these PGY1 programs? So what kind of tips do you have for, keeping yourself in line?
I did a lot of lists. I don't know about everybody else, but I had a checklist for every program. I went through every program I was applying to, and I wrote the deadline, what was required, and then I would just check off, as I went, the things that I did, and then looped back 100,000 times probably just to double check and forecast that everything was done for every program. But just for me, I'm like a writer and a visual person, so whatever works for you to stay organized and stay on top of things, that's what I would recommend to do.
I think time management is the lifetime mastering art that we continuously try to improve on. Giving yourself ample time is key. As early as the applications open, getting in there and just getting started. Every day, if you do a little bit, it will be better accomplished. I know it's easier said than done, but that really is a big help, just getting started and then building on it. Because if you try to do it all at once, a lot of times you'll feel behind and you won't be as effective or as the best as you can be. So just getting started as soon as you are able to.
Yeah, I did what Kylie did kind of. Like I made a list, I made like a calendar of all the residency like program deadlines, and then I kind of worked backward from there. So like if it's due on the 30th, well, I would want to have my letter of intent like drafted by like, a few weeks beforehand so I can send it out and get feedback on it. And then, kind of doing that with like all the programs, CVs, and then also like making sure like all my letter writers knew what the requirements were, like anything like that. So just kind of making a list or a calendar, like whatever helps you the most. And then what like Dorcas said, just keeping yourself accountable. It helps to do it with friends if you have any friends who are also applying, so you can kind of help each other out, keep yourself accountable, and remind each other.
Yeah, I'm pretty much gonna repeat what they said, but I also made the list for the last 2 years, and just refined that list as I was going through. And I definitely had some friends who were also doing PGY2s and PGY1s, and so just talking to them about it most of the time. And if some of them were applying the same program as I was, then that would be helpful as well. But honestly, making the list is probably the best way to do it. I'm not sure what else you can really do, but yeah.
Yeah, I definitely had an Excel spreadsheet with all of my stuff. So kind of same thing. And I think Genevieve touched on something really important that I don't know if you guys picked up on, but give yourself time to get feedback on those documents. So ask somebody or a few somebodies to read over your cover letter. Ask somebody not involved in pharmacy to read your cover letter so that way somebody that has no idea what's going on can see if, number one, they understand what you're trying to say, but number two, they also might just do a better job at checking grammar and spelling, because they're not kind of skimming over things that are familiar to them. So that was probably some really good advice that I received. So have people in pharmacy and your friends help you out and read those things, but also having somebody totally outside of pharmacy read over your stuff to make sure that it sounds good works really well. Ask your preceptors to look over your CV and give you any feedback. If you're a student member of ACCP, we offer a letter of intent and cover letter review service. So utilize those. I review for them. I think I've been doing it for 4 or 5 years now. So that's a great way to get feedback from somebody. And it's anonymous feedback too. So that's really nice as well. So there's a lot of things that you can do, but I think definitely when you're pulling these things together, asking for feedback is really important. Let's see. Okay, so another question from a student: how open did you keep your options in terms of specific areas of study? So I guess in terms of looking at rotations, in terms of I guess variety, in terms of what you were looking for. And feel free, Tyler, if I didn't ask that correctly, feel free to type something so that I clarify, but we'll start with that.
I can go first. So I knew I was interested in critical care, and my plan was to pursue a PGY2 in critical care. So kind of top of my list were programs that had a PGY2 in critical care. And then the rest were programs that at least had those rotations as an option. But then with that, I also knew that I wanted the opportunity to explore different things, even if I did pursue PGY2 in crit care, because I would have a whole year for that. So I wanted a place where I could do many other things, because this is really your time to learn and absorb everything, is PGY1. So I would say that I kept my options open, but with an idea of what I wanted so that I could set myself up for the next step. So, I mean, that's a really hard balance to find, and that's a really hard choice to make, but you have to kind of think about where you want to be after this, but also think about what you want to get out of this year as well. So.
And just a little bit of a different, I guess, perspective on that question too. If you think you're interested in, let's say, ambulatory care, during your APPEs, if you have electives, it would be a good idea to maybe do a rotation, an elective rotation in that field. One, just to get the experience, and two, to see, hey, is this something that I am interested in pursuing long-term? So being strategic about your APPE rotation, the electives, will be a great way to prepare you for the actual rotations during the PGY1.
Yeah, so personally for me, I think it kind of dates back to when I was an APPE student. So I took as many rotations as possible just because I wasn't really sure exactly what I wanted to do for PGY1. And my last cycle, cycle 9, like right before graduating, was actually in ambulatory care. So you never really know when you kind of like find something interesting or you fall in love with it even. So for me personally, it came at the end of my APPE rotations, and then I kind of prioritized that going into PGY1 just to see if it's really something I would want to do. So I think that's like the last like time to really explore as much as you can while having like a preceptor to guide you as well. So take advantage of that, and you can really get a lot out of it.
Yeah, I had a similar experience to Shivam where I used APPEs, like I really solidified that I wanted to do a residency, but I didn't really know like which specialty yet. So then like going into PGY1, I made sure to like schedule all the ones that I was really interested in before mid-year, so that like now I kind of have a better idea of what I would want to specialize in when I'm applying for PGY2s.
Yeah, I think that's all great. And if we didn't touch on it, I was going to ask about it anyway, but especially for, it looks like we have a lot of like P1, P2, potentially P3. I'm just looking at the screen I have up now, students in this chat. So I think optimizing your APPE rotations is really important. And I know like that's one area where like I wish I had done a better job of maybe really challenging myself during my APPE rotation. So, you know, if there's an area that you're uncomfortable with, like maybe you despise ID, I would strongly encourage you to pick an ID APPE rotation if you're interested in going for residency, because it will help you get stronger in that area, but it also shows that you are willing to kind of tackle those things that are more difficult for you. So yeah, if you're interested in doing a residency, which, you know, can be, you know, great learning experience, but also challenging, I would encourage you to really take a hard look at which APPE experiences you want and try to select those in areas that interest you, but also select ones that you know will be challenging. Let's see what else we have here. So we can probably expand on this a little bit, but someone asked, is a PGY2 required if you do a PGY1? So I guess to kind of expand on that too is like, what would make you decide that you wanted to do a PGY2?
So I can talk a little bit about that just from, you know, kind of a manager standpoint and what we look for in pharmacists when we are recruiting. So, you know, I'll say it really depends on what you want to do with your career and, you know, kind of where you want to go. Like what is your 5-year, 10-year goal? And that's just in general a great question to know the answer to. One, just to have a direction to go in with life. But I guarantee you will get that question multiple times as to what are your 5 and 10-year goals. So, you know, I'll pick on Kylie because I can. At least 3 of my residents are here. You know, Kylie has decided what she wants to do with her career, and she wants to go into critical care. So if you decide you want to go into a specialty area like critical care or ambulatory care like Shivam, a PGY2 is very, very important, and I would say almost required for that type of a specialty position. It provides you with the specialized training and knowledge that you would need to be able to practice as an independent clinical pharmacist in that setting. I feel like the job market has changed a lot over the past 20, 25 years, where if this question had come up a long time ago, I don't know that would have necessarily been the same answer. In other cases, such as myself, you know, I did a PGY1 and decided I didn't want to do a PGY2 because there wasn't a particular area that I was truly interested in specializing in at that time. So I transitioned over to working in the hospital setting and moving into an internal medicine role when I had that opportunity. So, you know, I kind of let the opportunities that came up kind of drive where I ended up in a management position. I don't know that this is necessarily where I thought I would end up 5, 7, 8 years ago, but you know, this is the career path that I kind of went down. So I didn't necessarily need a PGY2, but again, you know, I graduated from pharmacy school 11, 12 years ago. So the job market was very different then. And again, I chose a career path that didn't necessarily require specializing in a specific area. So I would say it really depends. The answer is no, you don't have to do a PGY2, but it also is, it depends on what you want to do in 5 or 10 years. And I would definitely encourage you all to reach out to a mentor, whether it's a professor or, you know, a pharmacist that you know that is working, to try to help you understand what are your goals, what is the career path you're looking at, and what may be, you know, the best option to choose in terms of residencies, fellowships, PGY1 or PGY2, and you know, there's plenty of other options out there as well.
Yeah, I would definitely agree with that. I'm with Kunal. I graduated pharmacy school. It'll be 10 years in the spring. And I would say it depends on where you work too, in that like there are certain areas like, and granted this was 10 years ago, but I have friends that never did a residency that now work like in an ambulatory care clinic in Pennsylvania, but that particular health system very commonly does rotations with the students from that school. So they were more willing to say like, hey, we know the work ethic of these students, we know the education that they're getting, you know, we will happily take them on and train them in the way that we want to do it. Like we'll take them without a residency. And the same could probably be said for, you know, like a position where you do have a PGY1 under your belt, and maybe you spend a few years as like a decentralized pharmacist where you've got some order verification staffing component, but you also are involved a little bit clinically in some of the decisions that are being made on the floor and like making interventions. And over time, you know, just with practice in that area over a few years, you know, you could move into a more clinical role. But I do think anymore the market has kind of changed in the sense that if you know you want to be a specialized clinical pharmacist or a clinical specialist, that doing the PGY2 route is probably in your best interest, or at least considering going that route is probably in your best interest in order to secure some of those positions. Now, there may be hospitals in more rural areas or, you know, elsewhere in the country where, you know, it's maybe not as strict, but I know for like a lot of the positions that I've applied to, and especially like positions around here, it's usually PGY2 at least preferred in that area if you're just going to be like a clinical specialist for that area. If anybody else has anything, you can chime in. If not, I do have some more questions coming. Let's see. So we have a question. Is there anything that you wish you did before you began your residency? Anything with school, anything personal, anything you can think of?
So as I mentioned before, I transitioned from retail, and I was in retail in the thick of COVID. So it was a lot of hard work, and I knew that transitioning into the residency was going to be a lot of time and devotion there too. So I did take a little bit of time just to reset before I started my residency. I took a trip to Italy, not to say I won't go to Italy, but just do whatever it is that is resting or enjoyable for you before you do start the residency. So in terms of like a personal note, just keeping in mind that it's going to be a very challenging year, rewarding, but very challenging, and maybe kind of just taking a little bit of rest or reset to make sure that your mind is right, your body's right, and you're just prepared for that next journey ahead. It's important.
I did the same because I worked for CVS and they conned me into working like an extra 2 weeks, but I booked a trip to Disney and me and my now husband went on a trip to Disney for a week after I was done with CVS before I had to move and start residency. And that was kind of like a nice way to take a break and reset and kind of get everything from the last, you know, year kind of out of my system before, you know, jumping into the next year of what I was going to do with my career. So I do think some of those things can be important to kind of set your mind straight. And I know with graduation, it can be kind of tricky. So some residencies do start mid-June. I would say the vast majority probably start July 1st. So you don't have a whole lot of time, especially when you're considering the fact that you have to like study for and take your NAPLEX and MPJE and all that kind of stuff. But I think doing those things is important. I don't know if any of our other current residents did anything or kind of wish they did something.
I went on vacation. I took the vacation. I think it was worth it. It was necessary. You don't want to burn out before you even start. So definitely take time to rejuvenate and like find your peace and whatever you need to do before going into residency. But with that said, I do wish I started studying for the Netflix a little sooner, just because it gets stressful. I took it as early as I possibly could, but just getting started so that you're like on your way. And then the first month of residency, you can really just focus on taking the exams, I think would be ideal.
Yeah, I just want to echo what Kylie said. I also took time off, like visited family, traveled, but then like, you know, you want to start studying for the NAPLEX like as soon as possible as well, and like getting your board exams through. But definitely super important to like take a second after you graduate and like celebrate that you graduated before jumping into a residency or whatever your next job is.
Yeah. All right. We're going to backtrack a little bit. So we do have some, like I said, like P1s and P2s on here. So we've talked about letter of intent a few times. If anybody wants to kind of give like a better clarification of what that is, because I think that is a very new concept for a lot of our kind of early in the academic path pharmacy students.
Yeah, so a letter of intent is basically like, it looks like an actual letter. You can look up examples of it online. It looks like an actual letter, and it's basically just writing to the program, like introducing yourself, like why exactly you're applying to a residency, like what made you want to apply, like what your goals are in the future, what your interests are, and then kind of just like talking a little bit more about yourself. So if you think about the rest of the application, it's like a CV, which is like a list of all the things that you've done, and then you have like your letters of rec that sometimes that that your writers will talk about you from their experiences, but your letter of intent is how you can kind of showcase yourself and like kind of show the program who you are as a person a little bit more and get to know them before the interview.
And sometimes the programs will specify specific things that they want you to include in your letter of intent. So always be aware of that and make sure that you address those points in your letter of intent also.
Yeah, so one of the things we talked about a little earlier when we were talking about letters of intent is they're probably one of the more challenging parts of an application, because you have 1 page or 3/4 of a page to introduce yourself to the program, right? It is oftentimes the first thing, although it's not the first thing in your packet the way forecast works. It's probably one of the first things that I read in almost every packet, because it sets the stage and it helps introduce this person to the program who the program may have never met before. It sets the tone for reading the entire packet. So it is one of the most critical parts of that packet. Don't be afraid to kind of showcase your personality and try to show the program who you are. But at the same time, also remember you are applying for a job essentially. So you want to have a professional tone to it. It should be polished, no grammatical errors, punctuation errors. As somebody had mentioned earlier, make sure it's addressed to the right person. So you have to kind of find a way to achieve that balance of professionalism, but also showing your personality. And don't hesitate to show your letter to others to get some feedback from them. Many of the faculty that are at FDU have gone through residencies, have read letters of intent, and they can provide you a lot of great feedback on areas that your letter may be strong in and areas that you may want to improve in. So always keep that in mind.
Yeah, I think that's great. And like John, if you said, it is like an actual letter, like it's addressed to somebody Usually you can figure out who that is pretty easily by just looking at the residency's website, and you address it, you know, dear whomever, and then there's usually multiple paragraphs, an introductory paragraph, a paragraph kind of talking about your goals, a paragraph talking about why you're a good fit for the program, one talking about why the program's a good fit for you. So it really is kind of like the same way you would write, you know, a snail mail letter to, you know, a friend or relative or something like that, just more professional. Okay, so we have another question. Night, kiddo. My son's going to bed. Go ahead, Kim. When is a good time to take the NAPLEX? So I know we've talked a little bit about, you know, making sure that it's scheduled in between, you know, graduation and starting a residency. So what advice do you have for that?
My advice is to take it when you're ready. So there's no specific time, I would say. If you're doing a residency, unfortunately, you do have to pass it before like a certain amount of time. Like you have to be licensed for, I don't know, Kunal, you can correct me if I'm wrong, but like 75% of the year, something like that. So usually that may be a deadline of like October 1st or September 1st, somewhere around there. So you do have to take it July, August, or even before the residency starts, possibly. But honestly, that first month for most programs is usually like an orientation type of month. So you're just going around the hospital, getting used to things. So there's time for you to study. And you know, you're not really starting any research yet. You're not on a clinical rotation, so there's not as much work in general. So there's a lot of time to study. So don't rush it and take it whenever you're ready.
Yeah, I agree. Last year, I asked the past residents like what their advice was, and everyone's advice was like take the NAPLEX, you know, as soon as you can. Make sure you're ready, but take it so that that's not looming over your head, you know, as you go into your clinical rotations, and so that you can start staffing and getting exposure to things early on as possible, at least. And it was such a weight off my shoulders once I passed those tests and I had my license and I could just start like really working. So.
Yep, I echo what both Kylie and Shivam said. Take it as early as you can, as long as you are ready to take. Because the job that you go to, whether it's a full-time job, a residency, you know, there will be different requirements in terms of when they expect you to be licensed. So you always want to keep that in mind and give yourself plenty of time. Sometimes testing locations get filled up very quickly. Sometimes the Board of Pharmacy, I should say sometimes always, the Board of Pharmacy is always slower than you want them to be. So take those things into consideration. Actually, this year they were pretty quick. I was actually very surprised. I think I told Kylie and Deanna that I was shocked how quickly they actually got their license number after they passed their second exam. So, because remember, you've got to take the NAPLEX exam and the law exam before you will get your license number and be able to practice independently. So keep those things in mind and, you know, keep a timeline for yourself. So if you know you need to be licensed by September 1st, you know, kind of backtrack into that and see how early you feel like you're ready to take the NAPLEX. Everybody's going to be very different. Everybody's test taking skills are very different. I will say that when I took the NAPLEX, and I think the test has changed a little bit since then, but you know, when I took the NAPLEX, I felt like I didn't really learn anything from studying that I hadn't already kind of encountered during rotations. Rotations really is what helped me prepare for the NAPLEX more than anything else. And not to say that I didn't spend time with a book and go through questions and things like that. I absolutely did. But I think the rotations truly prepared me for my NAPLEX. So you may be more ready and more comfortable than you think you are. So always have faith in yourself and know that you have spent years studying for this. So it's not just the few weeks or the months that you have leading up to the NAPLEX. So, you know, like I said, take it as early as you can, but ensure that you're ready for it and you have enough time before you need to be licensed. Yeah,
and to kind of add on to that too is like, I don't want to force you into, you know, taking it too early, but at the same time, given like the deadlines for residency, there is like a chance, like in the unfortunate event that you do not pass the NAPLEX, which that will not happen to any of you. you do have the chance to take it again and do that before like the cutoff for like jobs or residencies. So like keep that in mind too. Like you want to take it when you're ready, but you know, you don't want to take it, you know, 2 weeks before the deadline for your residency program in the unfortunate event that something happens. So you kind of have to have that good balance of, you know, taking it when you're ready, but also giving yourself enough wiggle room on the in between just in case. Like it's always like, you know, prepare, you know, expect the best, but prepare for the worst just in case. And then someone asked kind of like a clarifying question just about going into rotations before passing the exam. I think we kind of touched on this really briefly, but yes, you can start rotations before passing the exam. You're just limited on like what you can do in terms of like, you can't practice with a pharmacist license. So like you wouldn't be able to verify orders or staff on your own. Without having your license. Things would absolutely have to go through like your preceptor or another pharmacist before you were able to kind of do things independently. But like all residency programs and all jobs have a time frame for when you need to be licensed by. That's set by ASHP. Like Shivam said, it's like something along the lines of like 75% of the year you have to be a licensed pharmacist so that you can get the most out of your residency, because you're supposed to be practicing as a pharmacist. You just kind of have your preceptors as like backup and to help teach you things that you don't yet know. So you are practicing as a licensed pharmacist in that time frame. If anybody has anything else they want to add to that, you know, feel free.
Yeah, it's typically 90 days.
Yeah, that's what I think. There was one job that I had that was like 120 days to get licensed, and that's definitely the exception, not the rule. All right, so we have a little bit of time left. So why don't we kind of touch a little bit on like preparing for interviews. So if you each have maybe like one tip on how best to prepare for the actual interview process, what would that be?
One of my best tips would be to actually have like a mock interview. So have someone work with you and actually go through an interview process. I think sometimes preparation is key, and going over those like questions that we often will see would be imperative. So definitely preparation and actually practicing your interviewing skills.
Yeah, I think.
And what I'll add to that is similarly to, you know, what we were, oh, sorry, Shivam. Similar to what we were talking about earlier with our showcases, right? And knowing the program and knowing where you're going, it's even more important when you do an on-site interview to know that program as well as you can. Know their core rotations, know some of their preceptors and their backgrounds. You know, some of these programs are very large, so nobody's expecting you to know everybody at that program, but you know, if you're interested in critical care, it's probably worthwhile to know who the critical care preceptors are. What are the critical care rotations that are offered? You know, we've had candidates that come in that even know, you know, the training background of our preceptors. A lot of this information is all on our website, which is great that, you know, folks are actually going to those websites and reading them. But at a minimum, know what's on the website. And if you happen to know the residents that are there, talk to them beforehand. You'll have potentially interacted with them at Idea or a career fair. Maybe you've emailed them or talked to them offline, but try to know as much about the program as you can so that you can go into that interview being prepared, that you know the basics, and then you can ask kind of the next level of questions that you're trying to learn from. Because as I mentioned earlier, you want to try to understand what the environment is like, what the mood of the program is like, so to speak. So you want to try to kind of get to that level.
Yeah, so Kunal kind of stole mine, but it was definitely like knowing your preceptors who was interviewing you. Because in that way, if you know who's interviewing you, you can kind of maybe look them up a little bit. Like, you know, we obviously have access to the internet nowadays, right? So you can Google them, you can find their LinkedIns, and you can find out if they've done research before, and, you know, get an idea of what they've done in their careers up to that point. But if I had another piece of advice, it's that most of these interviews require a presentation. So practice that presentation. sometimes you may need to make an entirely new presentation for that interview. So like speaking for PGY2, I had to make an ambulatory care specific presentation for my interviews. So I chose a case that I saw on my AmCare rotation as a PGY1 and just prepared in advance in terms of like presenting it and potential questions that may be asked. So it's not just going to be like interview questions, like, you know, tell me something, a fun fact about yourself, but there may be clinical questions that are going to be asked as well.
Yeah, preparing is super important, but there's always going to be questions that you can't prepare for. So just kind of like get into the mindset of like saying, oh, like that's a really good question. Like, can I get a second to think about it? And then like, just, it's okay to like not say the first thing that comes to your mind. Like just make sure that you don't let the, you know, the random questions like throw you off.
Yeah, I would agree with what everyone said. I had looked up like a list of common interview questions or common residency interview questions, just kind of thought about what I would say and made a list of like my experiences that I felt I would want to highlight. So it's easy, like off the top of your head, to forget everything you've done ever. So I just like prepared a list ahead of time. So I knew, like, you know, my they asked you like your favorite intervention, like what was a great patient interaction that you had. So just like having those stories to come to your mind faster. And then like Shivam said, you have to prepare a presentation for some of them. And some of them had clinical cases too. So I just reviewed like common clinical topics just so I could speak to them. And my topic of presentation, obviously. So yeah, just being prepared, being yourself.
Yeah, I think those are all really important in terms of like, there are common questions that a lot of places ask. So kind of keeping a running tab of things that you're doing on your rotations is great. And now that you guys are doing like your field encounters and stuff, so like for current P4s, you know, go back and look at some of those interventions that you made, and maybe try to jot down as many details as you can remember from that intervention, so that you can bring it up. I think, you know, Kylie has a great idea of, you know, just writing down a list of things that were significant to you on each rotation that you can pull from. And I think a lot of times the other thing that we like to see, if you do have like a case or you have clinical questions that are asked, like, you know, we don't always expect you to know the perfect answer. If there's something that you should remember, like I was listening to a recap of like one of these events from a couple of years ago to like help guide my thought process on questions. And it was like, you know, if we're talking about like covering Pseudomonas, you know, we don't want to hear that you're using like cefazolin for that. That's kind of like a little bit of a red flag. And I know this might be a little much for the P1s, but if you don't know the answer, like it's okay to not know the answer, but we do want to know how you're going to think through it. You know, what references would you use? You know, kind of where would you look to find the answer? Kind of like start working on like talking yourself through some of those things. We like to know that you have the ability to problem solve, even if you don't like know the answer straight away, because that is also a really important quality to have as a resident. And I think, I don't know, Justin, if it's 8 o'clock now. I know there was one question in here that we didn't get to, but I think it's one of my students. So I can talk to her about it later.
Well, I mean, first of all, I want to say thank you all. That was super fantastic information, chock full of content for everybody to kind of disseminate. It is 8, but if anybody wants to stay on, if you do want to answer the question, I think we can swing a few more minutes, if that's okay. So do you want to answer it, or should we conclude?
No, I think we're good. The student that asked it is on rotation with me next block. So we can chat about it then.
No problem. So again, I want to thank everybody for spending an hour of their evening tonight connecting with our students, answering questions, giving them some insight into the residency processes, the truth of the processes. So if we can get thank yous in chat from everybody, we really appreciate the time tonight. This was great. I know this is also great information on our students having the ability to connect to residency programs, not only during Friday's career fair residency showcase, but more specifically at mid-year and any other future engagement. So I appreciate you all. Thank you all so much. Have a wonderful night. And if there's any questions, I will send out some of the contact information from our panel, so that way you may follow up as appropriate. So good night, everybody. Thank you all. It was fantastic.
Thanks, Tristan. All right.